So now we know, for sure, the COVID Inquiry's report on healthcare set out in devastating detail how the National Health Service in the UK was pushed to the brink during the pandemic. It described a system entering the crisis ill-prepared, already in a parlous state, and surviving only through almost superhuman efforts by staff. But it stopped short of naming the people responsible. If you want to know who they are, you'll need to keep watching to the end of this clip. To find them, you have to turn to the Inquiry's previous report, which examined political decision-making at the highest levels of government. Taken together, the two reports do something the Inquiry itself avoids stating plainly. They link political decisions to real-world harm. I turned both reports over to an AI and asked it to go one step further, linking the decisions that caused the harm with the politicians who made them. This is its response. Okay, in the next section, I start naming names. The Inquiry found that the NHS entered the pandemic understaffed, under-resourced, and running at dangerously high occupancy. That did not happen by accident. It was the result of policy changes made under David Cameron and George Osborne. Their austerity programme set strict limits on public spending, including health. Those limits were implemented within the NHS by Jeremy Hunt. As Health Secretary, Hunt was directly responsible for workforce planning, hospital capacity, and system resilience. Under his watch, the NHS continued operating with too few staff and too few beds as demand increased. When Theresa May took office, she did not reverse these policies. Hunt remained in office until 2018, followed by Matt Hancock. Neither introduced the level of investment needed to increase resilience. By the time Boris Johnson entered Downing Street, the Inquiry had already identified fatal strategic flaws in the UK's pandemic preparedness. He inherited that system, but chose not to fix it. Responsibility for the NHS entering the pandemic in a weakened state therefore lies across Cameron, Osborne, Hunt, May, Hancock and Johnson. But wait, there's more. Watch the next section to find out. The Inquiry specifically found that the UK was not properly prepared for a fast-spreading respiratory pandemic. Preparedness is a basic responsibility of government. That responsibility sat with Cameron and Osborne, who set the overall direction of policy, Hunt, who oversaw NHS preparedness, May and Hancock, who maintained the system without correcting its weaknesses, and Johnson, who led the government immediately before the crisis. When the Inquiry identifies fatal strategic flaws, it is saying these people failed to ensure the country was ready. It gets worse, so keep watching. The Inquiry acknowledges that the government response involved making it up as we went along. That's a quote. That responsibility lies squarely with Boris Johnson and Matt Hancock. Johnson led the national response. Hancock was responsible for health policy and NHS readiness. The consequences were clear. Hospitals redeploying untrained staff, routine care cancelled on a massive scale, infection control breaking down under pressure. This was not inevitable. It was the result of entering the crisis without the systems those politicians were responsible for putting in place. Remember the failure to provide proper protective equipment? You're about to learn who was responsible. The Inquiry found that NHS staff were left with inadequate and sometimes inappropriate protective equipment. Responsibility here is direct. Matt Hancock. As Health Secretary, he was responsible for stockpiling, procurement, distribution and policy on PPE use. The failure to supply adequate protection and to update guidance quickly enough as understanding of airborne transmission improved falls within his remit. But the problem spread hospital-wide, and responsibility for that was shared between, well, you'll know in a moment. Hospitals entered the pandemic with little or no spare capacity. That was not a short-term issue. It was the result of long-term decisions taken under Cameron and Osborne, Hunt, May and Hancock, and Johnson. Running the NHS close to full capacity was a deliberate policy choice. When demand surged, the system had no room to absorb it. And what happened? Find out now. You won't like it. The slogan, "Protect the NHS," became one of the defining messages of the pandemic. The inquiry found it had unintended consequences. People avoided seeking medical care, even when seriously ill. Responsibility for that messaging lies with Boris Johnson. This was a government campaign, not an NHS one. The inquiry also found that insufficient thought was given to the indirect consequences of decisions like this. Those consequences included delayed treatment and preventable harm. Let's see who was responsible for that in the next section. The inquiry documents a hidden toll: cancelled operations, delayed diagnoses and worsening illness. Responsibility lies with Boris Johnson, Matt Hancock and Rishi Sunak. Johnson and Hancock oversaw decisions to prioritise COVID care over other services. Sunak's role matters because economic policy influenced how restrictions were applied, which in turn affected pressure on the NHS. These were political choices with real consequences. Keep watching to find out what they were. The inquiry found widespread burnout, trauma and staff leaving the NHS. Responsibility spans Cameron and Osborne, who created the funding constraints, Hunt for workforce policy, May and Hancock for failing to expand staffing sufficiently, and Johnson for managing the crisis with an overstretched workforce. COVID exposed the problem, but it did not create it. And there's still more. Shielding was a centrally designed policy, and it was poorly implemented. Responsibility lies with Matt Hancock and the Johnson government as a whole. Errors in classification, communication, and support were failures of policy design. The next section covers an infamous claim. Keep watching. Ministers repeatedly claimed they were following the science. The inquiry makes clear this is not the full picture. Scientific advice informed decisions, but politicians made them. Responsibility therefore lies with Johnson, Hancock and Sunak. They made choices involving trade-offs between health, the economy and society. Now let's talk about what it all means. The inquiry separates how decisions were made from what those decisions caused. But when you put the two together, the conclusion is unavoidable. Cameron and Osborne set the financial constraints. Hunt implemented them in the NHS. May chose not to reverse them. Hancock continued them and then led the health response. Johnson led the country through the crisis. And Sunak shaped the economic framework. Together, those decisions created the conditions in which the NHS was pushed to the brink. Responsibility has been ascribed, but what about accountability? Without naming responsibility, failure becomes abstract. And when failure is abstract, it can be repeated. So there you have it. The names have been named. I've done it for you. Responsibility has been ascribed, but none of the people concerned have been held accountable. Almost 250,000 people died with COVID-19, and I'm not sure anybody knows the number who died because care for their illnesses or conditions was withdrawn in order to allow an overstretched NHS to better fight the pandemic. And Boris Johnson, to name just one example, is being paid hundreds of thousands of pounds to espouse his ideas in a national newspaper. These people are responsible for decisions leading to the deaths of your family members, friends, colleagues. The list goes on and on. They may be responsible for harm to you if you had health conditions that went untreated because they did not fund and resource the NHS properly. And the economic harm caused by their decisions is still being felt by all of us, even today. Are you happy to let them get away with it? What would you like to see done about it?